frequently asked by individuals who are in the health and wellness industry, how do you attract healthcare professionals into the wellness industry? Physicians have received very little training in nutrition and absolutely no training in nutritional supplementation. They are basically disease-oriented and drug-oriented. Most of them have learned in medical school that their patients do not need to take supplements, but instead just eat a healthy diet. This was certainly my story, and this is what I told my patients for the first 20 years of my clinical practice. Now, chiropractors, naturopaths, acupuncturists, physical therapists, massage therapists, and other healthcare professionals are generally much more open to nutritional and preventive medicine. In fact, I have always shared with my friends who are chiropractors that they should be the nation's true healthcare experts. Physicians are our disease care experts. Healthy lifestyles, along with nutritional supplementation, fit so well with their adjustments and their clinical approach to healthcare. Their entire approach is to allow the body to function at its optimal level. When you combine this approach with their manipulations and adjustments, you allow the patient to decrease their dependence on medication. However, I must admit that in the last few years I have seen more and more physicians who are interested in recommending nutritional supplements to their patients, and some are even interested in the financial aspect of direct sales through their office. Certainly, physicians are interested in anything that can potentially improve their patients' health. I have always looked at nutritional supplementation as giving me another tool in my toolbox that can potentially help my patients maintain their health and in some cases even help them regain their health if they've already lost it. Providing the body with optimal levels of all these essential nutrients through diet and supplementation allows you to optimize the body's natural defense and repair systems. This is complementary medicine. When I look at how many of my physician friends developed an interest in nutritional medicine, it is amazing how many were introduced to the health benefits of nutritional supplements by their spouse. This was certainly my case. Therefore, if you are trying to attract a physician into your business, I would recommend first focusing on their family or their spouse. I can share over a dozen situations I'm aware of personally where this approach was the key. Unless you are trained as a pharmaceutical rep and are very comfortable approaching a physician in their office, it is best to only approach healthcare professionals with whom you have a personal relationship. This would be considered to be your warm market because you already have a relationship with them and therefore have a better chance to have them listen to what you have to say. One of the greatest assets you can have in network marketing and direct sales is trust and a good reputation. If people respect and trust you, they will usually give you the courtesy to listen to what you have to present. This is no different with a healthcare professional. When I am asked what is the best way to approach a healthcare professional and exactly what should I talk to them about, I generally answer them by talking to them about the obesity and diabetes epidemics. Physicians, like all of us, struggle being able to help their patients with these issues. I specifically recommend that they consider offering their physician or chiropractic friends a copy of my book, Healthy for Life. Now, there are nearly 30 pages of medical references in this book from the leading medical journals throughout the world. This is what physicians want to see. I have also learned that when you begin talking about healthy lifestyles first, that they are more receptive to listen. Talking to them about a healthy diet that does not spike their blood sugar and eating plenty of fruits and vegetables along with increasing their intake of the good fat as they decrease their intake of bad fat is always well received. Then discussing the health benefits of a modest, consistent exercise program for themselves and for their patients. Then you can talk about the fact that because of our consumption of low nutrient, high caloric foods that are green harvested, shipped long distances, genetically modified and nutrient depleted, none of us are even getting the minimal nutrients our bodies need. Therefore, we need to be supplementing our diets with high quality, complete and balanced nutritional supplements. I find that physicians in general are struggling in their treatment of their patients who have early insulin resistance or prediabetes. They are beginning to recognize these early signs in their office, and yet there is no drug that they can prescribe for them. In fact, the American College and Association of Endocrinologists, those diabetes specialists, have just released a consensus opinion that physicians need to be treating their patients with prediabetes as aggressively as they treat their patients who have diabetes. However, when they looked at the worldwide medical literature to learn what was the best way to treat prediabetes, they concluded that it was intensive lifestyle changes that improved insulin sensitivity. This is Ariix's weight management system. When you combine Slenderex, a 1250 low glycemic diet, modest exercise, and at least the optimals, you are combining an intensive lifestyle program that improves insulin sensitivity. I know of many healthcare professionals who would love to have this program to offer their patients. You literally have the answer to the obesity diabetes epidemics that you can share with the healthcare community. Even if the healthcare professional is willing to try this approach with just a few of his or her patients, I personally believe the results they will see will convince them to continue using this approach with their patients. Now, there is one final word of caution when presenting to physicians. Physicians are always concerned about selling something to their patients where they may have a financial gain. There's an ethical consideration, and each and every physician has to make a personal decision on how they want to deal with this situation. I learned years ago the best way to handle this concern was to tell my physician friends that they did not have to be financially involved. I certainly encouraged them to use the nutritional supplements, but they could become a preferred customer and would not receive any financial gain from their recommendations. Many physicians like this approach. However, others would come right back and state the fact that they were looking at this opportunity as a way to not only help their patients, but also a way to have a financial gain. It has been interesting to me that when you take financial gain concern away from physicians, that you will quickly find out what their desire and considerations are.